Hello everyone, welcome to mindbraintalks, the place where you find diverse and scientifically accurate information regarding psychology, neuropsychology, neurosciences and research methods every single week. My name is Bruno Faustino. I am a licensed clinical psychologist and neuropsychologist who's been working as a therapist, researcher and educator for the past few years. Here in mindbraintalks, I discuss and describe different topics from psychology to neurosciences, and I try to explain them the best as I can for you to learn something more about it. All contents here are just for educational purposes and it's not intended to diagnose any psychiatric condition or neurological disorder. So, without further delay, let's jump for today's content. Today's topic is related to clinical psychology. What is clinical psychology? What clinical psychologists do? I will try to answer these questions with this video. So, this video is very important to me because, as you know, I am a clinical psychologist and I am a researcher. In this sense, I will describe to you the essentials and the fundamentals of clinical psychology. I will describe here the major theoretical approaches that clinical psychologists use to identify and describe normal and abnormal behavior, and I try also to explain the differences between clinical psychology, psychotherapy and psychiatry. So please stay to the end of the video. So now let's look to the manuals that I recommend to you. The first is Introduction to Clinical Psychology. The second is the Oxford Handbook of Clinical Psychology. The third is the Clinical Handbook of Psychological Disorders edited by David Barlow. The fourth is What Works for Whom, second edition from Peter Fonagy. The fifth is the Oxford Handbook of Research Strategies for Clinical Psychology. And the sixth is the Clinical Psychology, Science, Practice and Culture. And now let's see what is clinical psychology. Clinical psychology may be viewed as a branch of psychology, typically focused on applied psychology. It's focused on the assessment and intervention in mental health conditions and psychological disorders. Typically, clinical psychologists fundamental their basis on a research-informed practice, and clinical psychologists need a master or a doctoral degree to exerce this profession. So, in a more in-depth definition of clinical psychology, we pass by this. The field of clinical psychology integrates science, theory and practice to understand, predict and alleviate maladjustment, disability and discomfort, as well to promote human adaptation and adjustment and personal development. Clinical psychology focuses on the intellectual, emotional, biological, psychological, social and behavioral aspects of human functioning across the lifespan, in varying cultures and at all socioeconomic levels. Clinical psychology is focused on psychological assessment, which is a core skill of clinical psychologists. Typically they use clinical interviews and observations, neuropsychological tests, personality tests, intelligence and achievement tests, and clinical scales to understand behavior and to understand and differentiate abnormal and normal behavior. Clinical psychologists use this information to identify psychological functioning and the relationship of this psychological functioning to symptomatology. This information from psychological assessment tend to inform diagnosis, treatment selection and prognosis. There are different theoretical orientations that clinical psychologists tend to perform in the university settings. So let's see the main theoretical orientations. So the first is psychodynamic psychotherapy or psychoanalysis. The second is cognitive or cognitive behavior oriented therapies. The third is humanistic or experiential approaches. The fourth is systemic or family system therapy. And the fifth, which is integrative psychotherapy, which is a form of psychotherapy that tends to have different views from every specific theoretical approaches and try to use the best of them to incorporate in a different view of case conceptualization and clinical decision making. As a clinical psychologist, my main theoretical roots are in cognitive behavior therapy and in integrative psychotherapy. In this sense, I have these two main theoretical approaches that can help me to understand normal behavior and abnormal behavior. In this sense, I am able to understand things from a theoretical standpoint from cognitive behavior therapy, from the first to the third generation, and I may also include some theoretical approaches from integrative psychotherapy, which is able to understand the main points and the main fundamentals of normal and abnormal behavior from different integrative theoretical points. In this sense, I can use two different views from clinical psychology, one focus in cognitive behavior therapy vision and one focus on integrative psychotherapy vision, to understand and to identify normal behavior and abnormal behavior. And then I can use these visions to better conceptualize patients and to better select different treatment options. So, this is why I use an integrative perspective on case conceptualization and clinical decision making. So, but don't worry, in the future I will make different videos and explain to you what is cognitive behavior therapy and what is integrative psychotherapy. So, stay tuned! Clinical psychologists tend to work in different psychological disorders, such as anxiety and depression spectrum disorders, such as social anxiety, generalized anxiety disorder, depressive disorder, and so forth. Bipolar spectrum disorders, such as bipolar type 1 or type 2. Obsessive compulsive disorders, OCD, hypochondria, trichotillomania. And somatoform and physiological disorders, such as somatization, conversion disorder, and others. Another psychological disorders that clinical psychologists tend to work on is trauma, dissociation, and post-traumatic stress disorder. Eating disorders, addictive and impulse control disorders, psychotic disorders, sleep disorders, sex and gender dysphoria, and personality disorders. So, clinical psychologists may work in different settings such as private practice, healthcare services, public and private hospitals and health clinics, schools, universities, and health departments in diverse companies. Clinical psychology is very similar to psychotherapy, however, there are small differences between them. Psychotherapy is also rooted in psychological approaches, such as CBT, psychodynamic, integrative. Psychotherapy may be viewed as an specialization of clinical psychology. So, clinical psychologists, to be psychotherapists, they must do an specialization on specific approach, specific psychological approach, to develop more core skills on psychotherapy. It requires more 3 to 5 years of specialized training to develop new core skills or to enhance relational skills to be a psychotherapist. Psychotherapists tend to be a more specialized approach to psychological disorders. So, psychiatrists may also specialize themselves in psychotherapy. It's the same to clinical psychologists, they must do the specialization to become a psychotherapist. And now let's look to the difference between clinical psychology and psychiatry. Clinical psychologists are trained in psychological methods and intervention tasks to deal with psychological disorders. They tend to have a more psychological and developmental view of mental illness. So, clinical psychologists tend to have a more contextual view of psychological disorders. Now let's look to psychiatrists. Psychiatrists are medical doctors who normally use medication to treat psychiatric disorders, and they tend to have a more biological view of mental illness. So, if you have a more biological view of mental illness, they try to treat this mental illness with medication. On the other hand, psychologists try to treat psychological disorders through psychological methods, behavioral methods, cognitive methods, and relational methods, which is very different from the approach of psychiatry that normally use medication to treat psychiatric disorders. Normally, a combination of these two aspects may benefit the patient. So sometimes it's better to combine these two approaches. So a patient may have a psychiatrist and a clinical psychologist and a psychotherapist to work from relational methods to treat his illness. so both may have an integrated perspective of biological and psychological view of psychological disorders, which is the normal way of today. Today, psychologists and psychiatrists, they both have a view where psychological disorders are the result of biological factors combined with environmental factors. That's why that an integrated and a combined approach from medication to psychotherapy or clinical psychology approaches may be a better option to treat, and they tend to have better results in clinical outcomes. So, as you are seeing here, psychotherapy may be viewed as an specialization of clinical psychology. Typically, mental health professionals who study to become psychotherapists are clinical psychologists and psychiatrists, because these are the ones who have a major theoretical background in psychological processes, and then they are able to understand how to apply psychotherapeutic principles within a therapeutic relationship and to apply these principles to enhance cognitive, emotional and behavior change. That's why these professionals are more qualified to become psychotherapists. However, they all must study more 3 to 5 years. It depends from country to country. It is important to know this is a brief video about clinical psychology and psychotherapy. There are many important topics that were left out from this video, so don't worry, in the future I will produce some different videos focused on these specific subjects, so stay tuned. So now let's just summarize the contents of today. We saw that clinical psychology is focused on mental health conditions and it's a branch of psychology. We saw also that clinical psychology is focused on the assessment and intervention in diverse psychological disorders. Psychological disorders have different spectrums and are diverse from anxiety to personality disorders. And clinical psychology is somewhat different from psychotherapy, and psychotherapy is somewhat different from psychiatry. Well, it's all for today. Don't forget to see the video description regarding today's theme, to look to the manuals and the books that I recommend to you. Also, if you like what I'm doing here, please consider to subscribe and hit the bell for notification. You may use the comment section below to express your thoughts and to express your mind. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye! Hello everyone, welcome to Mind Brain Talks, the place where you find diverse and scientifically accurate information regarding psychology, neuropsychology, neurosciences and research methods every single week. My name is Bruno Faustino. I am a licensed clinical psychologist and neuropsychologist who's been working as a therapist, researcher and educator for the past few years. Here, I discuss and describe different topics from psychology to neurosciences, and I try to explain them the best as I can for you to understand and for you to learn something about it. All contents here are just for educational purposes, and it's not intended to diagnose any psychiatric condition or neurological disorder. So, without further delay, let's jump for today's content. Today's video is focused on psychotherapy. Today, I will describe to you the main theoretical approaches that clinical psychologists, psychotherapists and psychiatrists tend to use to understand and describe normal and abnormal behavior. Also, these theoretical approaches tend to have different forms or similar forms of case conceptualization and clinical decision making, and we'll take a brief look on them. So if you like psychotherapy, this is a video right for you. So now let's look to the manuals that I recommend to you. The first is Introduction to Clinical Psychology. The second, the Oxford Handbook of Clinical Psychology. The third, Clinical Handbook of Psychological Disorders. The fourth, What's Worked for Whom, second edition, a critical review of psychotherapy research. The fifth, the Oxford Handbook of Research Strategies for Clinical Psychology. The 6th, clinical psychology, science, practice and culture. The 7th, the Handbook of Psychotherapy Integration from John Norcross and Marvin Goldfried, which is a very good manual. Counseling and psychotherapy theories in context and practice. And the last one, a similar one to the previous, Theory and Practice of Counseling and Psychotherapy, the 6th edition from Richard Nelson Jones. So now let's see what is psychotherapy. Psychotherapy is the informed and intentional application of clinical methods and interpersonal stances derived from established psychological principles for the purpose of assisting people to modify their behaviors, cognitions, emotions, and/or other personal characteristics in directions that the participants deem desirable. This is a very wide definition that came up from Norcross in 1990. This definition, it's a widely accepted definition, and that's why I'll give it to you here. So now let's look to different aspects of psychotherapy. Psychotherapy may be viewed as a specialization typically done by psychologists and psychiatrists. Typically, psychotherapy must be or may be symptom-focused or structurally or personality-focused, when an individual must structure some aspects of personality, or when individuals need to reduce some symptoms of anxiety, depression, anger, and so forth. Psychotherapy may unfold through different stages and may work through different mechanisms. However, we will look to this in the future, okay? And typically, psychotherapists tend to use an evidence-based treatment, which is a treatment that has been studied in paradigm of a process and outcome. So now let's look to the major theoretical orientations. The first is psychoanalysis and psychodynamic psychotherapy. The second is behavior therapy. The third is cognitive and cognitive behavior-oriented therapies. The fourth is humanistic or experiential approaches. Systemic or family system therapy. And the last one is integrative psychotherapy. So now let's look a little bit more in detail these different theoretical approaches, and we'll try to see some essentials from each approach, okay? So let's go. So psychoanalysis and psychodynamic psychotherapy is the first one. Psychoanalytical approach was founded by Freud in the beginning of the 20th century and was focused on the unconscious domains of the human mind. Constructs of ego, id, superego, and transference were the main constructs from this theoretical approach. So Freud was the main proponent of this theoretical approach. However, Carl Jung and John Bowlby were also very important and had major contributions to psychoanalytic theory. However, during the 50s, 60s, and 70s, many new approaches were developed as alternatives to the traditional psychodynamic approach. And we can differentiate four main branches: Freudian psychology, ego psychology, object relation psychology, and self-psychology. And from this differentiation, different forms of therapy emerged, such as brief psychodynamic psychotherapy or, more recently, mentalization-based therapy. So, now let's look to behavior therapy. Behavior therapy applies theories of learning and conditioning to the understanding of human behavior and the treatment of behavioral and psychological problems. Typically, it's based on learning principles, operant and classical condition, and social learning theory. Eysenck, Skinner, Wolpe, and Lazarus were very important in the development of behavior therapy. So now let's look to cognitive or cognitive behavior-oriented therapies. Became popular during the 1970s and is based on the principle of the relationship between cognition, emotions, and behavior. Typically, cognitive or cognitive-oriented psychotherapists try to understand how cognitive structures, such as schemas, expectations, assumptions, or attributions, and cognitive processes, such as cognitive biases or distortion, tend to influence normal and abnormal behavior. Typically, we can call cognitive or cognitive behavior therapy as the first form of the integrative psychotherapy because it was the integration of behavior and cognitive assumptions. So, in cognitive behavior therapy, there are different models and approaches. The first is the rational emotion behavior therapy from Ellis. The second and the most popular, cognitive therapy from Beck. The third, cognitive restructuring from Mahoney. The fourth, stress inoculation and self-talk from Mike and Baum. And the last one, the concept of self-efficacy from Bandura. So now we can have a third generation of CBT, which has incorporated mindfulness, acceptance, and self-compassion methods. The first is acceptance and commitment therapy. The second, compassion-focused therapy. The third, mindfulness-based cognitive therapy. And metacognitive therapy. There are lots of third generation CBT that were not mentioned here, okay? However, in the future, I will produce different videos where we can take a deep look on them, okay? So, as you are seeing, in cognitive or cognitive behavior oriented psychotherapies, there are different approaches or different subfields that all share in common the main theoretical or the main principles underlying the cognitive behavior therapy, which is the cognition mediates the relationships between emotions and behavior. However, despite this theoretical assumption of the traditional cognitive behavior therapy, the third generation of cognitive behavior therapies added new assumptions which led to new theoretical principles and new clinical applications. But in future videos, we will explain these assumptions with more depth, okay? So now let's look to humanistic or experiential approaches. Typically, they employed philosophy, existentialism, and theories of human growth and potential to understand human behavior. They were focused on the patient's experience and phenomenology and offered warmth, empathy, and unconditional positive regard. The humanistic approach that is more recognizable is the Carl Rogers approach, which was a client-centered and phenomenological approach. However, Maslow, Pearls, and Viktor Frankl are major theorists that were very important in expanding the humanistic approach. So now let's look to systemic or family systems therapy. Family systems approach emerged from the Bateson project during the 1950s and were focused on the utilization of the entire family in the understanding and treatment of psychological disorders. Typically, systemic psychotherapies focus on different aspects and functions of family relationships. Main authors that we can recognize from this approach are Bowen, Bertalanffy, Bronfenbrenner, and Belinsky. So now let's look to other theoretical approach, which is the integrative psychotherapy. This type of approach tries to combine different aspects of other theoretical approaches in order to develop a new case conceptualization and clinical decision making tailored specifically to the needs, styles of communication, and features or characteristics of each individual. So now let's look to this. Researchers and clinicians felt dissatisfied with strict adherence to one particular theory or theoretical orientation. So, they try to focus on integration of concepts, principles, and strategies from different theoretical orientations to fit patients' characteristics and specific needs. So, this notion was based that every theoretical approach has some level of evidence. So, psychotherapists may use one of these four theoretical approaches to work within an integrative psychotherapy paradigm. The first is common factors, the second is theoretical integration, the third is technical eclecticism, and the fourth is integrative assimilation. In the future, I will produce different videos talking about these specific ways of psychotherapy integration, okay? So now let's look to some therapies that were based on one of these principles of psychotherapy integration. Clinical psychodynamics, trans-theoretical process of change, cognitive behavior simulation therapy, systematic treatment selection, and multimodal therapy. However, there are other forms of psychotherapies that were based in these four integration principles. So, emotion-focused therapy, schema therapy, metacognitive interpersonal therapy, paradigmatic complementary metamodel, and cognitive analytic therapy. So now let's just summarize the contents of today. Psychotherapy may be viewed as a specialization based on psychological approaches. When we look to psychotherapy, we can look to traditional approaches such as psychoanalysis, CBT, but we can also look to modern approaches such as third generation CBT, brief psychodynamic, and we have this last theoretical approach, which is integrative psychotherapy, that is focused on the use of different elements from other theoretical approaches in order to enhance case conceptualization and clinical decision making. Well, it's all for today. Don't forget to see the video description regarding today's theme to see the manuals and the books that I recommend to you. Also, if you like what I'm doing here, please consider to subscribe and hit the bell for notifications. You may also use the comment section below to express your mind and to say something about it. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye!